Just to introduce ourselves, I'm Felicity. I'm the Clinical and Care Professional Lead for Innovation for the South East London ICB, and you are the fabulous...
I'm Jules Hillier. I'm the Chief Exec of Pause, which is an organisation that works with women who have or are at risk of having more than one child taken into care.
And I've had the benefit and privilege of being a part of your organisation in the past, which was a wonderful experience, which is why I've learned so much from you about how to do innovation and how to do workforce innovation. So the first thing I wanted to ask you about is that we are facing a bit of a crisis across the health and social care system, in that we're finding it very hard to fill lots and lots of different roles. And we also know that we need to do better to honour the skills and experience and identities of staff coming into our organisations, particularly those who face protected characteristics. We know that if we reduce the need for professional registration and qualification, we're going to diversify our workforce. But the next question that comes up for us there is that how on earth would you ever do that safely? Your organisation has done that. You're working with very, very, very high levels of risk and complexity across so many vectors at once. Health, safeguarding, children safeguarding, adult safeguarding. And then I'd love to hear how you manage it.
Okay, so yeah, the women that Pause works with are some of the most complex women with some of the most difficult and dangerous lives. So they're in a cycle of repeated pregnancies that result in removal of children from their care, but this is a transgenerational cycle. So they may well have been in care themselves, their mothers may have been in care themselves. What we do is we recruit for the people that we know will be best at working with those incredibly difficult, complex women with difficult lives, complex women with difficult lives. And sometimes those will be people with a formal registration and qualification. And sometimes those will be people that don't. But that qualification isn't for us the thing that means that they're going to be best at working with women. There are many other factors that we see in people that come from a whole range of different backgrounds. So about 50% of our practitioners do have a social work qualification, but that's 50% that don't. Now, a few of those have other qualifications, medical or education qualifications from other sectors. But actually, those people who come from just experience of working with very traumatized, complex people, and who have a whole range of skills that aren't the skills that get you a qualification, but are the skills that make you brilliant at making relationships, because making relationships is almost the most important thing that we do. So qualifications is a bit of it, but most definitely not all of it.
Well, let's hear from you a little bit then. Like, have there been any benefits to opening up? Because it was actually while I was in part of Pause actually that stopped being a requirement, the professional registration. Were there any benefits that came with opening it up?
I mean, I think there are the same benefits of opening up a kind of position on registration that there are to diversifying a workforce in any way. The richness of experience, the barrier to entry. When you remove a barrier to entry, you increase the breadth, the range of experience, the richness of experience, the range of backgrounds, the range of competencies and skills and understanding. And one of the things that is, I think, present across everybody who works in Pause, whether they have a professional qualification or not, is their willingness to learn. In fact, more than willingness, their eagerness to learn from other people. So it's not like we have, a whole bunch of people with professional qualifications kind of folding their arms and saying, well, I know everything, so I have nothing left to learn. It just isn't like that. Everybody continuously learns from everybody else. I think one of the things we do that's really important is when people come into the organisation and have an induction in the organisation, we ask them to think about what they're bringing, the skills that they bring. Do you know how difficult it is, whether you are qualified or not, to get somebody to open up about how brilliant they are. People just don't like saying I'm amazing at this. But as soon as you can get them to do that, two or three other people will say, are you? Because I'm really interested in that. I'd like to find out more about it. So from day one, we're asking people, what are you good at? What are you best at? Tell us what you're good at, and then show everyone else. Because
Wow.
it's this richness of sharing and learning from one another is incredibly important.
First, I'd love to ask you. So you talk about learning, 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 and actually you reminded me that someone said to me recently, the definition of an expert is someone who is continuously learning. That's the definition of an expert. I thought that was really nice. That's kind of what it felt like that's what you're
Yeah.
speaking to. And you're facilitating expertise. Your organization is all about facilitating expertise. Um, so so I guess, and one of the ways that you recruit for that is you've referenced values-based recruitment, right? It's not that we're not looking for a qualification, it's just that actually a qualification might not tell us anything about
Yeah.
your curiosity and your lots of those other diverse skills. So I'd love to hear from you. You've talked about a learning organization. You said something really interesting to me. You said, Felicity, how do you create a learning organization through a trusting
Yeah.
organization? Can you speak to that? What do you mean by that?
Well, I mean, I actually think any organization, regardless of whether it's a learning organization, has to be a trusting organization, because it's vital. If you have trust in your processes, if you have trust in the work that you do, then you have to absolutely have trust in every single person doing it.
Can I give a
So
couple of examples of that, Jules, from my own
yeah,
experience of being
yeah,
part of Pause? So one of the first things is that we have to submit quite rigorous data
yeah,
regularly, and we would have that data scrutinized and really carefully pored over. But when you come down to look through our data with us, if there's a variance in the data from what you're expecting, that's a prompt to appreciative curiosity.
yeah.
But
So
let's
it's
ask a
always
hard
much more
question then.
appreciative, I think. Sorry.
Yeah, no, no, completely. And that was my experience, which meant that, and I think what that did for me is that it meant that I was much quicker to come to you if I thought there was a problem,
Yeah,
because I wasn't waiting for you to find fault. I knew that you would come as a practice lead in your service, in your organization. I would go, if there was something going wrong, because I wasn't worried that I was going to be blamed, I would be coming right away to be like, hey guys, we've got this problem. So actually it created much more of a culture of picking up on problems earlier rather than later and working together to fix them. Is that, yeah.
I think that's probably true. I think there's something else that we've got that really helps with that, and that's the relationship between each practice and their national practice lead. So we have roles called national practice lead, and a national practice lead will be responsible for supporting up to 8 practices. And I'll go back to what I said before about some of the skills we need. They build a relationship with the practice. So the national practice lead and the practice create a relationship together. And when you have a healthy relationship, you can talk as you go along about some of the stuff that's come up. So
Are there
those
any?
national practice lead roles, I think, really help to build the trust
Yes.
across the organisation and share that learning and thinking.
And actually, if from my experience on the ground, my experience was is that the practice lead would be coming in precisely to absorb learning. It wasn't that they were coming down from the top to be like,
No,
actually, they were coming in to help facilitate learning across the piece.
well, so yesterday, this is a very apt moment to talk about this, because yesterday we brought 100 people together from across the Pause network, and the whole of the afternoon was about we went into 4 quite big groups, and about 20 practitioners shared resources or
Wow.
particular skills or particular ways of working that they have developed. And I was allowed to go along to some of these skill sharing exercises. So I have this is my when I feel stuck wheel, which one of the practitioners uses with women to help them to think about what what their tactics are for getting out of a stuck position. So
Wow.
at one point, that's what all the practitioners were doing, making what happens when I get stuck wheels and getting out of it. But it wasn't, it wasn't that all of the people who were sharing their skills were qualified, and therefore they were qualified to share their skills and other people had to learn from them. It was just the most extraordinary group with a real range of backgrounds, finding real inspiration in learning from one another. And I know they found inspiration because they came up and told me they did. And anyway, as I walked around, I said to them yesterday, I've never seen so much active listening happening in one room at one time. You know, they were just focused on listening to this expert talk about a tool they developed or a particular way they had of working, and it was generating discussion and it was sparking ideas, and people were going away saying, oh my god, I could do that, but I could do it this way in my practice.
Wow.
And that, you know, there's a real when you bring practitioners and others together like that, there's a real equity in the whole process of learning, because what you're doing is learning from people that have done something and thought about something and created something. And that's the only thing we need them to have done. We don't need them to have got a qualification or been here for so many years or worked with this number of women. You know, there's a real sense of equity in that, I think, which I enormously value.
I thank you. That's so helpful. And when I think about innovation, to me, when you're saying that, it's not about, I'm going to start this new project, that new project, that new project. Actually, what you're talking about is creating a system that is alive with innovation and facilitating innovation across the piece. That's so exciting. Let me ask you this. Have there been any downsides? Have there been any risks that have emerged from dropping that requirement for a professional registration or a particular qualification?
No, I don't think so. Actually, everybody that comes into pause brings something with them. Everybody that becomes a practitioner brings something different, you know. So no, I don't think there is a downside. I really don't. And I understand that a professional qualification is something that can give you reassurance when you're thinking about risk. And when you've got lots of risk to think about, the assurance that somebody has a qualification can feel really important. At the same time, if you are having constant conversations about risk and how you manage risk and what some of the scenarios that you might need to manage might be, and if you are constantly alive to the fact that you are an organization working with some of the most vulnerable women in some of the most dangerous situations in the country, then that risk is present for everybody. You know, that risk should be being thought about every single day on the ground, way before it gets up to, you know, me or our trustees or whatever. You know, there's so much risk management, risk assessment, risk management, risk mitigation that happens all the time. And you don't necessarily need to be qualified to be able to do that. You do need to be supported, and you need to be trusted, and you need to be trained and developed. And, you know, we put all of that investment into people because it's incredibly important. But it doesn't begin and end with the qualification. It begins and ends with the support and trust you give the workforce.
And creating those really open conversations, and perhaps always thinking, what are the barriers to openness and curiosity? Because those are the barriers to continuous learning. And I have to just share, because, you know, I always say it to you, but I'll never forget it, because I just found it lovely, that which for me embodies that thing that says, whoever you are, we value you. Of the time that I went to some pause conference or training event, and in my ADHD way got far too excited and did a song and dance for a group of people. And you phoned me up the next day, and I said, Jules, is it about that? Are you calling about that? And I know I shouldn't have done it. I shouldn't have done a song and dance at a training event. And Jules, you said, oh, Felicity, we love you doing things like that. We know that's you. You wouldn't be you if you didn't.
And that couldn't be further away from me. I'm always teased at events because I'm not the dancer and I'm not going out doing so. But, you know, it's incredibly important that we have people that are, because wouldn't it be tedious if nobody was ever dancing or singing?
It's bringing your whole self to work, isn't it? And yeah, and magic happens when we do it. Well, listen, you know, from me to you, thank you so, so much for being you and creating a space for practitioners to do that, and an organization that is learning and trusting. And thank you so much for sharing your wisdom with me today.